Good morning, everyone, and welcome to the Health Committee meeting for the County of Renfrew on March 9th, 9:30 a.m. I'm going to call the meeting to order. With that, I would ask first, Ms. Hill, has the roll been called?
Yes, Mr. Chair, roll has been called.
All right, thank you. I am uncertain. I am going to go directly to the committee. As we gather this morning, I wish to acknowledge on behalf of committee and our community that we're meeting on the traditional territory of the Algonquin. We thank the Algonquin people and express our respect and support for their rich history. We are extremely grateful for their many and continuing displays of friendship. We also thank all the generations of people who have taken care of this land for millennia. With that, I would invite any disclosure of pecuniary interest, and if any, the general nature thereof, please. I see none. Could I invite, please, a motion to adopt the minutes of the previous meeting held February 9th, 2022 that were circulated last Friday? Moved by Councillor Lafreniere, seconded by Councillor Love. Any error or omission? Seeing none, all in favor? That is carried. Thank you. There were no delegations at time of meeting. I am not aware of any. From that, then we will go directly into the Emergency Services Department report. Chief Nolan, the floor is yours.
Great. Thank you, Mr. Chair. And it's a pleasure to be here with the committee this morning. So through you two members of committee, item number 1 in today's Emergency Services report, Community Paramedic Program Update. I'm very pleased to be able to bring forward information that we are advancing the use of technology within the community paramedic program, which allows people to be able to stay in their own homes and be able to have a greater array of diagnostic capabilities. So point of care ultrasound, as some of you may know it, if you've had an ultrasound in the hospital, they come rolling down the hall with a big cart and have a look in your belly, have a look in your chest, maybe in your legs, and be able to get imagery from within your body to be able to actually see what's going on. The point of care ultrasound is now a handheld device that we have at the county. We've had a limited number of staff who have been using point of care ultrasound now for about 5 years. And we're just in the process, with the assistance of funding related to community paramedicine, that we're able to expand the use of point of care ultrasound. So that when we're assessing someone in their own home, for example, we can provide a greater range of diagnostics to keep them in their own home and be able to use that in consultation with their physician to be able to create a care plan. So that process is being led by one of our community paramedics who is working with the Canadian Point of Care Ultrasound Society so that we can now be an accredited organization to be able to provide point of care ultrasound. As well, we're working very closely with the High Intensity Supports Program and other agencies to provide this wraparound care. And in doing that, again, we're trying to keep people at home at all costs, especially older people who may have mobility issues. We know that, spending hours, if not days, in an emergency department or in the hospital can lead to other complications such as delirium and other behavioral issues. So keeping them home, while it may seem disconnected from just getting an ultrasound, having the paramedics with that capability in their pocket has proven invaluable. Item number 2, Mr. Chair, related to COVID-19 testing. We have seen a reduction in the overall numbers of people requiring tests based on the provincial policy. However, those people who do need a test tend to be within a high-risk category or have significant health concerns associated with the potential for them having COVID. So we have moved to the ID Now rapid analyzers in the county. So you may recall when at one time it took days, if not a week, to be able to get your test results. We now have the ability to provide test results within 15 minutes. And we have these ID Now analyzers throughout the county, and they are at the PCR quality, or the highest level quality for rapid analyzers that are available. So we're pleased that those are being offered. Same process through RC VTAC to be able to book your testing. But once again, I just want to remind people that the criteria for testing continues to shift as rapid tests became more prevalent in the community. And then the policy direction that effectively, if you have any of the symptoms, just stay home because you probably have COVID. We want to remind people that have significant comorbidities, work in healthcare settings, and so on, that we have these available throughout the county through our VTAC assessment centers. So please continue to work closely with VTAC in that regard. Item number 3 related to RC VTAC funding. We have received a letter of confirmation from February 14th that the Ministry of Health has provided approval continued COVID-19 in the fiscal year 2022-23, and that they'll be maintaining the current funding support for Renfrew County. So that's very information as it relates to the COVID assessment centers and the great work that RC VTAC has been doing. We did receive another letter that I think Paul's going to talk to in new business, because we are getting funding letters kind of getting peppered at us right now. And to determine what is eligible for what funding is becoming more and more complex. I did ask that one of the letters be held because there was some ambiguity within the eligibility and a reference back to a 2014 contract that I think was misplaced within the agreement. So I'm just waiting to hear back from the province on that. But very good news that I'm sure the chair or the warden will want to speak to in terms of the confirmation of funding for all of next year, so till March 2023. So very pleased about that. I'm also hearing that the OMA is in discussions with the province about alternate funding models for virtual care, and that's something that I think we need to keep a very close eye on to make sure that our physicians continue to be incentivized to provide the great services that VTAC does. Item number 4, Mr. Chair, related to the vaccine update. Looking at the end of February, mass vaccine clinics were transitioned to pop-up clinic model in response to our needs, and increasingly these vaccine clinics will be folded into what is the VTAC offering through our clinical assessment centers as those continue to evolve based upon the provincial direction. So we are also doing a significant number of in-home vaccinations. So while we're slowing down or shutting down on the mass vaccine clinics, we've gone to pop-ups, but we are continuing to do in-home vaccinations. And as different portions of the population become eligible for 3rd dose, for example, and there's even discussion about 4th dose. As we continue to evolve in that regard, we need to, as you can see from our vaccine statistics, we're doing exceptionally well, but overall there's still a little bit of work to be done. So the pandemic continues to be evolving, devolving, revolving. I'm not sure these days, to be honest with you, but as spring is coming, I'm as hopeful as the rest of you that these vaccine rates that we have will keep us in good stead, and I'm very pleased that the residents of Renfrew County and the partnerships between our organization, public health, hospitals, primary care, municipalities, right across the board, that we have the 3rd highest first dose, 2nd highest second dose, and 7th highest vaccine 3rd dose. And part of that is also about eligibility. So very pleased with those numbers. And I think despite the gravity of the situation and the prevalence of Omicron within the community, I think we've done extremely well in Renfrew County, despite the fact we have had loss. We have certainly had disruption, but I just want to express my personal thanks to you, Mr. Chair, the Warden, Council, the City of Pembroke, and all the residents in Renfrew County for their patience, their understanding, but I think most importantly, their ability to work with us to lessen the impact of this pandemic on our community. And I would say in retrospect, we've been able to achieve that to a significant extent based upon both the vaccine rates, but also the prevalence of community and what are by comparison relatively low morbidity and mortality rates to other jurisdictions. So not time to pat ourselves on the back, but certainly times to reflect and say that we've made some good decisions. Council has made some exceptional decisions in terms of staying the course, and I just want to thank them for that leadership as part of this process. And then item number 5, Mr. Chair, related to gratitude. And that is a letter from Chief Poirier related to the convoy demonstrations in Ottawa. And Chief Poirier did reach out to his neighbors for assistance in staffing and supporting regular operations in the city of Ottawa while they had extraordinary operations going on in the downtown core. So we were able to liberate some staff to be able to assist in that process. And in doing so, not only did that provide the city of Ottawa some relief, but it also very much assisted our regular operations by ensuring that our units weren't being sent into the west end of Ottawa on 911 calls, because we were able to stabilize that by leaning into Ottawa to be able to support that. So thank you to Chief Poirier for the letter of thanks sent to Warden Robinson. And we are working through the process of recouping any costs associated with that with Chief Poirier. So I expect that through my conversations with him, that we'll be able to send an invoice shortly and make that a revenue neutral experience for us that in fact help protect our community and its important resources. So maybe, Mr. Chair, I think that concludes the information portion of my report. Happy to pause there for you and take any next steps at your direction.
Thank you very much, Chief Nolan. With that committee, we will go back to information item number 1, the community paramedic program update with respect to particularly the point of care ultrasound. Any questions or comments? Warden Robinson.
Thank you very much, Chair. Through you to Chief Nolan. Chief, do we have enough ultrasound machines at the present time for your staff, or is it something we should be looking at adding to our budget at some point?
Yeah, thank you, Madam Warden. So through your chair. So as of right now, we have enough for the first phase of this rollout. I expect that with the addition of the clinical assessment centers through Renfrew County VTAC, there will be some additional equipment and supplies required. So should we end up going in that direction, I should be able to tap the RCVTAC fund to be able to support those purchases. I think to put this in context, I think for you, Madam Chair, and for the remainder committee, typically an ultrasound machine would be worth, $40,000 to $50,000. When point of care ultrasound, these literally pocket handheld units that you use off of the iPad that you already have, became more commonplace, they're now in the range of $5,000 per unit. Which is highly economical in terms of their use, because of course they're a multi-use device. So we may need some more. If we do, I expect it'll be as a result of the proliferation of the clinical assessment centers, or the physical places that we're creating to provide support to the VTAC role. And if we do, I'm certainly happy to bring that back to committee and council for discussion. But we should be able to do it within the funding envelope that we have for VTAC currently.
Thank you, Chief Nolan. Councillor Lafreniere, please.
Thank you. This is great news. Now people can get even more care in their home in consultation with their doctor virtually. I wanted to know, just a question for my own information. My husband, obviously, he's got compromised health issues, and he was talking to a specialist about a week ago on the phone, and they were shocked to know he didn't have a family doctor. They're in the city, and they just were blown away at the fact that we have thousands and thousands of people here without a family doctor. Someone like him, now, what kind of care can he get here if he was in a crisis from your service? Because I know he has called the doctor, the virtual triage, doesn't always get the results that his specialist would have hoped for. But if he needs blood work of a nature, like, he has to still go to the hospital, right? Your paramedic service does not do blood work or anything like that in the home, correct?
Great, Councillor. Great question, Councillor Lafreniere. Great, Councillor. So Mr. Chair, there's a couple of ways that I can answer that question. So first and foremost, it's not an uncommon narrative from a specialist to say that, a GP or a family doc didn't quite, meet their expectations as part of the process. So I don't see that as a reflection of VTAC so much as a normal level setting of expectations, especially between urban and rural environments. We have in the neighborhood of 25,000 plus or minus 5,000 people in Renfrew County that do not have a family doctor. So he's not alone. One of the main principles or purposes of VTAC has been to ensure that no one needs suffer in silence, but also that should you not require paramedics via calling 911 or an emergency department, that you have an alternative to that. And that really has been the crux of the VTAC role. We also have to recognize that VTAC is not full spectrum complex chronic disease management. It's intended for episodic care. There are some other advancements that have happened through integrated virtual care. So Petawawa, for example, has been able to onboard a significant number of patients that are in the high needs category. But when we look at, and without getting into your individual husband's circle, when we look at what VTAC represents, it's local. It will align them with specialists. It will provide referrals to lab work, to X-ray, to ultrasound. It'll also provide referrals to community paramedics to be able to provide a breadth of services depending on what someone's needs are. And the needs can be both medical, but they can also be mobility related needs. So paramedics do every day, community paramedics in Renfrew County do go into people's homes and do blood draws. And in some circumstances where we have ISTAT machines, which allow us to analyze that blood in your own home and have answers within a minute or so. In other circumstances, depending on the complexity of the specimen that's being collected, the paramedics will go into people's homes, draw the bloods, do a full physical assessment, answer any questions, and then take that blood sample to the lab so that your physician can follow up, or you can go online and look up your lab results yourself. Okay. So it is a mix, but what we don't do, and I think an important point is, if someone can get themselves to the lab, we strongly encourage that. Yeah. We're trying to do this as more of a complex chronic care for people that can't otherwise access those services. And that can be for a number of reasons. It's not only, an older population that has immobility issues. It can also be that you're so sick, you shouldn't be going out. Right. And we want to keep you at home so that, you're not making anybody else sick as part of the process, or we can keep eyes on you and put you in our remote monitoring program and keep tabs on things. So anyway, I hope that answers your question.
Yeah, it absolutely does. And I would imagine that any blood work you go to the home to receive would have to be recommended through one of the physicians through VTAC anyway, correct?
Right, yeah. So the way blood work begins is through a requisition. So whether that be through the VTAC physician as a requisition, but if the paramedics are getting a requisition to go in the home to do a blood draw, then that will come with a referral to the service. So we don't look at you as a blood draw. We're not vampires. We look at you as somebody who's got greater needs that, and it's probably a good reminder, we want to look at you and say, how can we help you stay home safely today? Instead of differently, how can we help you stay home and not have to call 911 or draw down those other services? This is a preventative service from both your health, but also to make sure that the very important and precious 911 ambulance resources are available for people when they need them. And by managing this other population, we can protect those resources. And VTAC has been unbelievably helpful in the paramedics' ability to keep people from calling 911 or going to the emergency department.
Okay. Well, thank you, Mike. Thank you.
You're welcome.
Thank you. Committee, any further question or comment? Just a couple, and one of them is following up on Councillor Lafreniere's experience. I don't think that that's uncommon. I think that perhaps the issue that we are dealing with the lack of family physicians, certainly very acutely here in the county of Renfrew, but I think it is not uncommon right across rural areas of the province, that it's invisible. And I think that that certainly is a challenge for us to make sure that it remains seen in the light of day at all times. The other thing that I have to say, Chief Nolan, is the handheld unit that you're talking about for the ultrasound, where Dr. McCoy was prescient, or in fact, perhaps he's just following up on our initiative some 200 years from now. You committee may know Dr. McCoy better as Bones McCoy, who used to wave that thing around someone and immediately be able to diagnose them. We are, in fact, following up on the prescience, perhaps, of Mr. Gene Roddenberry. Following up then, item number 2, the COVID-19 testing update. Once again, not so much a question as just a comment, I think. And Chief, you will be, I'm sure, very much aware of this. There are 2 components to the testing, and certainly from the response, in particular the acute response to Omicron, where we simply ran out of capacity to do testing any further, and we had to manage that in an alternative fashion. But we have returned to not fully even to the place that we occupied mid-December, but we are seeing declining numbers. And one of the things that has certainly occurred to me just prior to the more constricted or constrained testing framework, i.e. the high risk, et cetera, medical healthcare workers, emergency responders. Just prior to that, the province of Ontario was doing in excess of 60,000 tests, completing in excess of 60,000 tests a day. For about the last 10 days, the province of Ontario has been completing somewhere between 12 and 15,000 tests a day, where it may be waning from a response perspective. Epidemiology is critically informed by data. Are you aware, being one of the frontline testing agencies, is there any discussion of returning to a more open testing regime? Because I think that we are continuing, you have used the terminology, I think, before, which is we may be flying without our instruments all working. So I'm wondering, given that we're now testing or completing only about 25% of the tests that we were doing, say, 2 months ago, is there any expectation of a return to a broadened testing regime?
I'm just trying not to be cynical here, Chair. I would say no.
You leave that to me, Chief. I do that well.
I'm trying to stay in my lane here. I would say no, based upon some comments from some very senior bureaucrats that I'm working with, and effectively, what's being said is the province is trying to get out of the business of doing testing, and for whatever reason, there is no conversation about resuming more open and public testing. I guess I'll leave the rest to you. So the best we can do is remain experts in what we're doing, make the testing available to those that have the greatest need at this time. But this notion of surveillance seems to have fallen by the wayside.
Okay, thank you for that. And certainly within the media, within social media, unfortunately, even social media now seems to have replaced perhaps the Lancet or even the New England Journal of Medicine. I see that seems where some experts are going towards peer review. But in any event, it seems that has been a prevalence. Let's use that terminology. But surveillance, if you go all the way back to SARS, which very fortunately did not wreak the havoc globally that SARS-CoV-2 has, surveillance is the entry level. That's the foundation of public health. So I'm not going to pursue this any further at this meeting, but I think perhaps by the time this health committee is meeting the next time, it might be appropriate to give consideration towards corresponding with the province. In any event, any further questions on the testing? Seeing none, moving on to item 3, and I will just preface the item with respect to the one-time COVID funding. The expectation is that that's going to, we will take that up in new business after we have concluded with the long-term care report. So we'll keep it specific to the item that's in front of us on item number 3. Committee, any question or comment? Warden Robinson, please.
Thank you very much, Chair. Yes, I did make reference to this letter during my warden's address last month. Certainly it's good news. I'm cautiously optimistic that within the next year that we would receive confirmation from the province that our funding will be annualized. I would be lying if I didn't say that I'm a little concerned. I'm very happy for Minister Elliott and her retirement. She's done an amazing job for the province of Ontario and its residents. But again, little concerned that we're going to be losing our Minister of Health, who has intricate knowledge of VTAC and its importance. So, it talks about that the ministry has our proposal for expansion, and they'll contact us if they need more information. So, we need to not wait for that contact. I think we need to reach out. I know that Chief Nolan is in constant discussion with staff from the Ministry of Health and Ontario Health. So that makes me feel a little bit more confident. But at the end of the day, we just have to continue on to make sure that whatever the changes do happen within the Ministry of Health, that VTAC is not lost in the shuffle. Thank you.
Thank you, Warden Robinson. Do you wish to comment, Chief Nolan? I see your mic is open.
I would only go so far as to say, I share the trepidation. However, it's become quite consuming for me to stay on top of this, and quite a passion, I think, that's shared by all of us on this call to maintain this level of service. So we will continue to put our shoulder to this wheel. And I know we're coming into some political uncertainty this spring with an election, but I think our job day to day is to continue to provide an excellent service to the public, and on a go forward basis, make sure that the political champions are aware of really what represents an opportunity in VTAC. So, and I think that between the work of the warden, the EOWC, the chair, committee, council, and really all our residents, there isn't a lot more that we can do at this point, other than try and find a sustainable solution for a service that has really revolutionized healthcare in Renfrew County. And I'll continue to put my best foot forward in that regard as well.
Thank you, Chief. Just perhaps picking up a little bit on it. I think that this has, from its inception, springing forth almost overnight, 12 days, if memory serves. VTAC has proved its concept, certainly in relation to its founding, which was as an assessment center to respond to the then novel coronavirus, not so novel anymore. However, it has proven itself over and over and over. There's been a groundswell of support from our community that, and I would dare say, as Warden Robinson has said, from Minister Elliott herself, certainly from John Yakubuski, our provincial member of the Legislative Assembly. I think that the reason that this has been so embraced by our community is that it is meeting the needs, as Councillor Lafreniere had noted, as I had spoken to, the dramatic number, the disappointingly dramatic number of people that are without a family physician in the county of Renfrew is unacceptable and intolerable. And this is the means where we can at least make an initiative towards alleviating that growing concern. It has been recognized by the province, by the Premier himself, by the Minister of Elliott, and certainly by Mr. Yakubuski, that this is an outstanding concept, and it is one that can roll out across the province, and it is also meeting, it is checking almost all of the boxes that the province announced, this government announced just after taking office with respect to hallway health and reducing hallway health and the pressures that are being felt throughout the healthcare system. So with that, I think that we have certainly established the bona fides of the VTAC concept. And I think it's vitally important that this be front and center when we are going to the polls, both provincially and municipally this year. Councillor Murphy.
Thank you, Mr. Chair. And I just wanted to speak to the warden. I completely agree with you. It's a shame when you lose a minister that is such a champion of something. I will say, though, last week I had the opportunity to meet with Minister Tabolo's chief of staff, and he's the minister for under Minister Elliott for mental health and addiction. She was well aware of our VTAC and actually asked if there was any mental health component to our CVTAC. So I think that with the work that you and the chief and EOWC, and I'm sure there are other entities that have been working on this, I think that it's widely known through the provincial government. And I think that's the good news story. Thank you.
Thank you, Councillor Murphy. Councillor Lafreniere, please.
Well, I want to thank Councillor Murphy for that positive feedback. That would be my concern too. Any changeover in a political arena, and you know as much as anything in the county, you change different committee members often and they have to be re-educated. So it's comforting to know that maybe the minister under Ms. Elliott is aware and confident, but I know that the warden has worked hard, as well as Mr. Nolan, to get this supported and get the upper levels of government informed about it. So I know that you will continue to do that, but thank you, Councillor Murphy. That makes me feel a lot better.
Chief Nolan, I see your hand raised.
Yeah, thank you, Mr. Chair. I would only add as a reminder, in case there's future conversation, VTAC inspired a virtual mental health service in Renfrew County led by Mr. Lubomov and his subcommittee of our VTAC advisory committee. And I think we all know the significant importance to that. But VTAC has become a lot of things to a lot of people within Renfrew County, and we do have weekly meetings of our advisory committee that have continued on. And I think one of the things that I'm most proud of is that there is now a virtual mental health service available to residents of Renfrew County, which is spectacular, knowing the challenges certainly coming out of the pandemic, but also the lack of access to pediatric mental health services and family-related mental health services. So, our intention is to continue those conversations and to continue those groupings of services that at one time worked very much in isolation or got together at the invitation of the LIN and so on. We are now not only setting the table, we are also able to support organizations that really haven't felt this level of support before. And mental health, I think, is absolutely one of those organizations that has deserved the attention and the support that it's received through VTAC, and now it gets direct referrals from VTAC to its services. And I'm very proud of that. We've done other work in palliative care that I'm sure you're aware of. We've been able to access dental care for people who might not have otherwise had the means. So it's not just community paramedic, physician, medical receptionist service. It truly is a health system navigation, but also a stage for those that have an idea to bring it forward and to be supported in a way that's really turned into something very practical for our residents.
Thank you, Chief Nolan. Anything further on item 3? Seeing none. Moving on to item 4, the vaccine update. Once again, perhaps I'll prime the well. I think that these are astonishingly high numbers, though I probably should not have used the word astonishing. There is very little of the paramedic services is contributing towards the COVID relief that should astonish any further. It has certainly stepped incredibly forward, more than one step forward, several steps forward. And the results, I think, are simply outstanding. That this is within a particular community, and these are certainly what I would consider, Chief, high risk. Just wanted to also bring to the attention of the committee. So I certainly commended the province, the data sets that they have been keeping, notwithstanding the conversation earlier of testing, but the data sets that they've been keeping across numerous different particular issues with respect to COVID has been outstanding. Just to give you some impression even of the broader community, outside certainly of the at home, at risk, and high risk, within the 60 to 70-year-old cohort, this is within Renfrew County and District, at least one dose is now 99.63%, 2 doses is 98.2%, and 3 doses is 80%. This is data that was released yesterday that would have been effective end of day Monday. Within the 70 to 80-year-old cohort, it is essentially identical, though a higher booster rate at 88%. And finally, the 80 plus, once again, is essentially, for all intents and purposes, at 100% for first and second, and at 90% for third. The issue that I just wanted to bring forward is that the Omicron variant does seem to be incredibly transmissible amongst even those that are double vaccinated, but that third vaccine has been outstanding, even in limiting the infection rate, because the overall rate for 18 plus, and confining it just to the 18 plus, in Renfrew County and District is only 57%. Only 57% of our population has had the third dose. So I'm certainly going to keep my fingers crossed as we are moving forward in a more open environment. But I would certainly encourage our community that may be watching this, or that if the press is attending this conference or this committee meeting this morning, to also strongly encourage our residents to get the third dose, that booster dose. It does make a substantial difference for you. I will note, as I've said, the most at risk, it is reassuring that they have, by and large, taken up the third dose, but I would certainly encourage strongly our broader community to do so. And that's, I guess, all that I will say on the vaccines. Any further question or comment on this item? Seeing none, moving on to item 5 then. Very appreciative to receive this note. I know that was a particularly challenging environment for the City of Ottawa, certainly broadly, but also for the paramedic service. I think it is safe to say, Chief, that all of the paramedic services, well, right across the province, certainly here in Eastern Ontario, I'll confine my remarks to that, absolutely are always cognizant of our broader community and willing to step forward. And perhaps this is the opening to be able to address perhaps some of the outstanding irritants that may have existed as well. So I'm very pleased to receive this from the Chief Poirier. Anything further? Can I have a motion to accept the emergency services report, please? Councillor Murphy, seconded by Councillor Grills. All in favor? That is carried. Thank you. Thank you, Chief Nolan. With that, I see Mr. Blackmore is with us this morning. And Mr. Blackmore, we will go directly. What time are we? Oh, we're still good. Mr. Blackmore will go directly into the long-term care report, if you please.
Thank you, Chair Donahue. Good morning to you and committee members. Through you to committee, the long-term care report begins on page 9 of your package. Item number 1 is the COVID-19 pandemic update. Just to identify that the Bonnechere Manor remains in facility-wide outbreak since March 2nd with 4 positive cases on 3 of 6 units. And as of yesterday's report, 4 of these residents are asymptomatic. Mayor Michelot just confirmed outbreak effective February 25 for residents on resident home area 3A with 4 positive residents and 1 positive case as of yesterday for on resident home area 1A. And each resident at the lodge is currently experiencing mild symptoms. So as a result of these cases, a bit of a different scenario for each home in that Bonnery Manor is in a facility-wide outbreak, and Miramichi Lodge, the outbreak is restricted to the units 3A and 1A. So recently there was an announcement with regard to easing of restrictions. Of course, those easing of restrictions are not in place for those particular units. And for added precautions, under the guidance of the health unit, we're employing use of N95 mask and protective eyewear on each of those units. Tray service for dining where we can, recognizing that we do have a unit where that's not possible given the nature of the residence. But in that instance, what we've done is we've increased our distancing and put up some plexiglass barriers for dining as well. Social absences are restricted in those given units. We're cohorting staff to those units as much as we're able to do so. And affected residents, of course, are in isolation. And we've also increased our screening to twice weekly. And if I could at this moment, I'd just like once again to express my utmost gratitude to the incredibly resilient staff at both homes right now as we continue to endure through yet another round. And again, to echo Chief Nolan's remarks, express our appreciation to committee for supporting the protection measures in augmentation to those that are currently in place on a provincial level. So by way of example, both homes, we continue to do rapid testing on a daily basis. And we've employed a number of measures in addition to those that we're required to do. So as I had mentioned, the easing of restrictions to take place in February 21 for those residents on unaffected units. It just gives a bit of an overview of those types of restrictions. Essentially, general visitors 5 years and older may resume visits to the home. We've increased the number of caregiver visitors from to any one time to 3. Residents are allowed to go on social day absences regardless of vaccination status, and social overnight absences are allowed, but they're restricted to those residents who currently have 3 doses of vaccine. And just if I could, there are some additional easing of restrictions coming our way. As of March 14th, basically it's increasing the number of general visitors allowed and allowing overnight absences for residents regardless of vaccination status. But pleased to report that the greater majority of our residents have at least 3, if not 4. Well, the greater majority have 4 of their vaccines, and all but maybe 1 or 2 exceptional circumstances don't have 3. The next item speaks to the Premier's response to the ongoing critical nursing staffing challenges, that of a $5,000 bonus that was negotiated through ONA, as well as Resurrecting Late Career and new graduate initiatives. The payment will be coming in, it's been confirmed to be coming in 2 tranches, one in April, one in September. And it's been announced that that $5,000 will be prorated for part-time employees as well. Our advocacy agent, Advantage Ontario, has raised with the province that it's well and good. It's a good thing. This $5,000 is being implemented. Might argue be maybe more warranted, but anyhow, there are concerns that it's designated specifically to RNs versus across the healthcare spectrum for all allied health workers.
Sorry, Mr. Chair. I don't know if anyone else is experiencing this, but Mr. Blackmore is breaking up a little bit. So, Mike, maybe if you could turn off your video, that would help your audio, sir.
My apologies. Is that better?
I think perhaps, Mr. Blackmore, if you were to disable your camera, it might improve there. Thank you.
Is that better?
Yes, it is. It is extremely better.
Thank you. My apologies. Item number 2 is a It chronicles two separate anonymous complaints to the Ministry of Labor, one for each home, alleging that homes were allowing COVID positive staff to work. Inspector Paula McDonald concluded her investigation for both homes, affirming that both homes are in compliance with mandated infection prevention measures and controls. So unfounded. Item number 3 summarizes the Ministry of Long-Term Care Public Inspection Report from Miramichi Lodge. Per the hyperlink contained in the report, Inspector Susan Louie was on site over a period of 6 days and follow up to a critical incident report, and there were no areas of non-compliance identified. Item number 4 is presented as information for council who may be interested in attending the Advantage Ontario Annual Convention. Councilors interested may notify Diane Johnson per the email link below.
Thank you, Mr. Blackmore. I think perhaps just before we get into the resolutions, we'll address the information items as they have been presented. So with that, committee, I will go back to information item number 1 about the COVID-19 pandemic update, and certainly thank Mr. Blackmore as we have become accustomed from the time this was written until we are meeting today. I appreciate your verbal update, even to the update written in front of us. With that, committee, any questions or comments? Warden Robinson, please.
Thank you very much, Chair. Through you to Mike, you know, it's interesting if you listen to people outside of long-term care. Many people are talking about the fact that the pandemic is over, and you go into long-term care and it's alive and well and wreaking havoc. And I know I say this every month, but I think if I don't acknowledge what our staff are doing on a month-by-month basis, that I'm failing. So please let them know that we are so aware that, you know, as we move into 2+ years of being in a pandemic, that we know that our staff are absolutely incredible. And I don't know how we will ever thank them, but from the bottom of my heart, please tell them we appreciate everything they're doing.
Thank you, through your chair, to Warden Robinson. I would be most pleased to do that. Thank you very much.
Thank you. I think it is incumbent upon us, certainly would second that commendation to staff at both long-term care homes. This has certainly been a grind. We had just come out from outbreak status at the Manor, and here we find ourselves back in again. I think it is important, though, to acknowledge while this continues to be a scourge, if you will, it is a different COVID than the first wave. And it was interesting, Mr. Blackmore, correct me if I'm wrong, I thought you had identified that perhaps 2 of the residents at the Manor are PCR positive, but are asymptomatic. And I think that speaks to a particular insidiousness to COVID right from its onset 2 years ago, is its capacity to not even reveal itself by times. So I'm certainly enormously pleased that the vast majority of those in each of the long-term care are suffering mild symptoms. Hopefully it is contained within that, but I think it bears mentioning that while it certainly has driven the workload and the burden for staff, this is a different infectious virus than that from the first wave. And I think it is important to continue to note that as well. Anything further on the update? Moving on to item number 2 and the Ministry of Labor inspection. Item 3, the Ministry of Long-Term Care inspection. I think once again it bears mentioning just in that up is down, black is white, perhaps bureaucratic language. No non-compliances were issued essentially means there was nothing determined to be out of compliance. So very pleased at both of these reports where any issues were found not to be upheld. I think that speaks volumes once again to Mr. Blackmore's comments and to yours as well, Warden Robinson, that the staff have been exemplary throughout COVID and continue to be so. With that then, Mr. Blackmore, I will yield back the floor for items 5 and 4 moving forward, please.
Thank you, Chair Donahue. Through you to committee. Item 5 is a resolution seeking signing authority for Bonnechere Manor. A recommendation that the signing authority for Bonnechere Manor Trust accounts be updated to remove Kimberly Saunders and add Shiji Patel, Administrative Assistant Finance, effective immediately, and further that 2 of the following names have signing authority: Jeffrey Foss, Sandra Block, Michael Blackmore, and Shiji Patel.
I'll ask Mr. Blackmore, just before we get to background, I will ask for a mover, please. Councillor Emo, seconded Councillor Murphy. Back to you, Mr. Blackmore.
Thank you, Chair. To committee. As background, Kimberly Saunders resigned as administrator for Bonnechere Manor on February 28th, and recruitment for the position is currently underway. Shiji Patel is a successful applicant for the administrative assistant finance position and will commence her employment at Bonnechere Manor on March 14th, 2022.
Thank you. Committee, any question or comment on the resolution before us? Seeing none, all in favor? That is carried. Thank you. Moving on to the next resolution, item 6, Mr. Blackmore, please.
Thank you, Chair. Through to committee. Item 6 is also a resolution seeking revision of signing authority for Miramichi Lodge. A recommendation that the signing authority for Miramichi Lodge trust accounts be updated to remove Jill Eady and add Kim Prentice, administration supervisor, effective immediately, and further that 2 of the following names have signing authority: Jeffrey Foss, Michael Blackmore, Kim Prentice, and Brendan Mellish.
Thank you. Once again, I will invite committee a mover, please. Councillor Love, seconder, Councillor Bennett. Once again, background of Mr. Blackmore.
Thank you, Chair. Through you to committee. Background is Jill Eady resigned as the administration supervisor for Miramichi Lodge on December 16, 2021. Kim Prentice was a successful applicant and commenced her employment at Miramichi Lodge on January 4, 2022.
Thank you. Any questions or comments, committee? Seeing none, all in favor? That is carried. Thank you. Moving on to bylaws, Mr. Blackmore.
Thank you, Chair. Through you to committee. Item number 7 is a bylaw seeking approval for extending letters to the long-term care service accountability agreement for each of Bonnechere Manor and Miramichi Lodge. A recommendation that the Health Committee recommend that County Council authorize the Warden and Chief Administrative Officer Clerk to sign the extending letters for the extension of the long-term care service accountability agreements for March 31, 2022 until March 31, 2023 between Ontario Health and each of the Bonnechere Manor and Miramichi Lodge for submission by the deadline of March 30, 2022. And further that County Council pass a bylaw to amend bylaw 39-21, being a bylaw authorizing the Warden and Clerk to continue the long-term care service accountability agreement.
Thank you, Mr. Blackmore. Once more, committee, can I have a mover, please? Councillor Emo, second. Councillor Grills. Background, once again, Mr. Blackmore, please.
Thank you, Chair. Through you to committee. Background, Bonnechere Manor and Miramichi Lodge each entered into a long-term care service accountability agreement with Ontario Health with a request to sign extending letters for extension of the ALSAs for each of the Bonnechere Manor and Miramichi Lodge from March 31, 2022 until March 31, 2023. It's submitted by the deadline of March 30, 2022. The extending letters and bylaw are attached as Appendix LTC-1.
Thank you. Committee, any question, comment, discussion? I am presuming, noting the March 30th deadline, that we will have a car running in the parking lot with the letter to race it over to the post office, as the 30th of March is in fact our county council meeting. Hopefully everything goes swimmingly there. Any further discussion? All in favor? That is carried. Thank you. And finally, Mr. Blackmore, I believe finally, item number 8.
Thank you, Chair. Item number 8 is seeking a bylaw to approve the extending letter for the multi-sectoral service agreement for the Bonnechere Manor Adult Day Program. A recommendation that the Health Committee recommend that County Council authorize the Warden and Chief Administrative Officer Clerk to sign the extending letter for the extension of the multi-sector service accountability agreement from March 31, 2022 to March 31, 2023 between Ontario Health and the Monastery Manor Senior Adult Day Program for submission by the deadline of March 30, 2022. And further, that County Council pass a bylaw to amend bylaw 38-21, being a bylaw authorizing the warden and clerk to continue the multi-sector service accountability agreement at their next session.
Thank you. Once again, can I have a mover? Councillor Doncaster, seconded by Councillor Lafreniere. Background.
Thank you, Chair. Through you to committee. Background: Monastery Manor has been operating the Senior Adult Day Program in Renfrew since February 1997. For the continuation of 100% funding for the Monastery Manor Senior Adult Day Program, Ontario Health is requesting the signed extending letter for the extension of the multi-sector service accountability agreement from March 31, 2022 until March 31, 2023, and submitted by the deadline of March 30, 2022. The extending letter and bylaw are attached as Appendix LTC 2.
Thank you, Mr. Blackmore. Once more, committee, any question or comment? Seeing none, all in favor? That is carried. Thank you. Now, can I have a motion, please, to accept the long-term care report? Councillor Emo, seconded Councillor Love. A further and final opportunity for question on any item before us. Seeing none, all in favor? That is carried. Thank you. I am showing 10:26 in this part of the time zone. I think we will move on, Mr. Morrow, to the administration report, please.
Thank you, Chair. The administration report, sir, can be found on page 25 of your report. Flip to it here. First item, Chair, if I may, in the administration report is a recommendation for the Network 24 funding transfer payment agreement with the province of Ontario. If committee will recall, council agreed that the county of Renfrew would be the fund holder. That was some time ago. Committee should be aware that we have received the transfer payment agreement for those funds that we agreed to hold some time ago. So we are required to pass a bylaw and then submit the transfer payment agreement. Essentially, same conditions apply that we spoke about. I'm trying to think if that was June of last year. I'm trying to recall the date when council agreed to be the fund holder. But again, the funds would be held by the county of Renfrew. The administration and oversight of those funds would be through our accounting process, but the funds would be allocated through the steering committee of the Ontario Health Team. And we would also review this arrangement in approximately a year's time. So this is a temporary arrangement, and the recommendation that we have in front of us is to allow us to be in receipt of those funds. Chair, if I may I read the recommendation?
Please do.
That the Health Committee recommend that County Council authorize the Chief Administrative Officer to sign the Ontario Transfer Payment Agreement for Network 24 Ontario Health Team to receive funding in the amount of $1,125,000 implementation funds and $75,000 collaborative support from the province of Ontario, and further that a bylaw be adopted to execute a transfer payment agreement with the province of Ontario. Thank you, Chair.
Thank you so much, Mr. Morrow. Can I have a mover, please? Councillor Murphy, seconded. Councillor Love, any question or comment, discussion? Seeing none, all in favor? That is carried. Thank you. And I think notwithstanding that there was only one item, the fact of there being one item, we would also seek then a resolution to accept the administration report, please. Councillor Lafreniere, Councillor Love, all in favor? That is carried. Thank you. Bear with me one moment as I return to my agenda. Board of Health minutes are attached from the January 25th, 2022 Board of Health meeting. Can I have a motion to, I think we just received these. Is that correct, Mr. Morrow?
That is correct, Chair. A motion to receive the minutes.
Motion to receive those Board of Health minutes of January 25th, 2022. Councillor Doncaster, seconded by Councillor Bennett. Once again, committee, any question or comment? Seeing none, all in favor? That is carried. I do note that we are an hour in. There has been endless debate between my spouse and I on lengthy travels, that it is not entirely dependent on the person behind the wheel to determine what pit stop or rest stop that we pull into. Having said that, I am quite prepared to carry on down the road, but I would invite, is there anyone of committee does require a 5 to 10 minute break? I'm seeing none. We shall carry on. We are making good time. With that, then, I will invite Mr. Morrow. Perhaps you could illuminate to me who will be taking the lead with respect to the new business item that was circulated yesterday. It appears to be you. I will yield the floor, Mr. Morrow.
Thank you, Chair, and through you to committee. Yesterday, I sent out a letter that we received on February 25th from the Ministry of Health. Chief Nolan and I and Mr. Foss have discussed this letter at some length. We did receive just an email notification. I believe it was either the morning of or the day before. The warden would have received it as well, letting us know that we were getting this letter. So we received it on the Friday, the 25th, and we have been working to figure out what this letter means for us. And to be frank with committee, we're not quite there yet, and there continues to be a few issues with the guidelines provided to us by the province of Ontario. I will inform committee and let them know that, and as Mike indicated in his conversation with us, the province is essentially providing us or throwing money at us on COVID-related matters. In my initial comment with Mr. Foss, and I'm hesitant to go too far with this, we're not sure if we'll be able to spend this money, because many of the COVID expenses that we have received so far have been covered off by previous funds provided to us by the province. So, you know, the province has been very good with respect to providing us with COVID funding. This letter, as you can see, the schedule that is attached, is very specific to swabbing clinics and vaccines. And again, we've had much of that, those funding requirements covered off through our arrangements with the province and our prior regional health. So again, Mr. Foss will need to assess, and if the timing is a bit of a challenge because we're also at year end. And so we're closing the books on 2021, which this funding supports. I will ask Chief Nolan to jump in because the letter has an added twist that speaks to an agreement that dates back to 2014. And Mike has has reached out to his contacts at the province to better understand what that relates to. So we have some unanswered questions on this. I will assure committee that our COVID expenses and those associated have been covered off by the province. So it's less of a concern for us, but I do want to let committee know that we have some more work to do on this one and some conversations to have with the province first. Thank you, Chair. And I would, if with your permission, I would ask Chief Nolan if he has anything to add.
Thank you, Mr. Morrow. And I do note, Councillor Frenia, I think I will go to Chief Nolan perhaps to broaden the discussion a little bit before I invite any questions, please. Chief Nolan.
Yeah, thank you, Mr. Chair, and thank you, Paul, for the segue. Certainly this is an ongoing issue in terms of the complexity, especially related to community paramedic funding, because we get community paramedic funding now from, I think, 4 different sources, 2 different ministries. And there is an inference within this funding letter that dates back to an agreement of 2014. The only relevant letter going back to 2014 that we have with the province is related to the original $6 million community paramedic fund, of which we received about 400,000. So I need to make sure that we're not crossing swords, lanes, expectations in the allocation of funds. Of course, these funds are also intended to be retrospective to last calendar year, which is also, significantly problematic because we do our level best to not spend any funds that we don't already have approval for. So to receive funds almost posthumously in this process, it becomes increasingly difficult for us to provide good counsel to yourselves in terms of the best allocation of those funds. So we're we are proceeding as we always have, which is cautiously, but also optimistically that we'll have the ability to exercise as many of these funds as possible so as to decrease the impact on the levy and the local ratepayer, but also to be able to cover off what's really been an extraordinary effort. So, an example of that, of course, is VTAC has its own funding stream associated with it. However, as you'll recall, the work in vaccination was based upon an assumption that the province would be coming good for it. You know that we played a significant role in the vaccination efforts across the county. In our reconciliation of last year, we're going through to see what unspent revenue is left available to us to be able to cover that off. So I'm pleased that the province is stepping forward. I'm grateful that Paul and finance and my team are working through the detail of this. And we just want to bring it forward at a time when we have as complete a picture as possible for you in terms of what we can leverage and what we may end up having to return to the province. Time will tell based upon the interpretation that we receive back from the province related to our questions.
Thank you very much, Chief Nolan. Earlier in the meeting, I had ascribed or described rather that cynicism was one of my highly developed skills. I have an enormous faith and trust in the innovative skills that you have. I think that perhaps the full $1.5 million might be a challenge, but perhaps there are things that we can find. I am enormously curious that this is specific to the paramedic services. Do we have, in any of the discussions we may have had since the 25th, have we any idea what the impetus, where this came from, if not from paramedic services that were perhaps experiencing some fiscal challenges?
If I may, and Paul, if you're comfortable, this has been kind of an ongoing, and you'll recall back to the beginnings of the pandemic, we had to do things based on an assumption the province was going to pick up their share. And council was very supportive of that as a notion or as a principle. Unfortunately, the province is always about this late in terms of letting us know what we could have spent 6 months ago. So the challenge that we continue to face is the latency in this process. And, as difficult as, audio buffering and everything has been on today's call for all of the participants, this is just exaggerated in terms of what that funding relationship sounds like from the province as we go forward. So and then the other thing is that there is a ongoing challenge, and that is if we don't follow that, 6, 12, 18 months from now, there will be yet another reconciliation and be happy to say that we charge the province for things that were ineligible. So we need to be cautious and we need to be safe in those things that we allocate to these funds, as I think any ratepayer would expect us to be. But know that, to your point, we've become very good at squeezing every penny out of every dollar to be able to increase the level of service to our population. And as stewards of those funds, we will always try and maximize the value of every dollar that we receive. And no different than with this 1.5 million. I guarantee you we'll squeeze out of it everything that we can, but it will all be in the name of providing better service to our community.
Thank you very much, Chief Nolan. For those who may be familiar, it almost sounds like the plot line from Brewster's Millions. You got 2 days to figure out how you can spend $1 million. I noted, Councillor Renfrew, you had your hand up earlier.
Yes. So I see that the actual funding schedule says recipient name County of Renfrew for County of Renfrew Paramedic Services. But then on the next page for the guidelines, it says to provide one-time funding to support paramedic services and dispatch centers as part of the COVID-19 response. Now, I know the city of Pembroke, we had some vaccination clinics as well, but it was not performed by the paramedic service. So would that fall under this umbrella? It's kind of the
I am-
guidelines don't match the payable too. So,
I'm inclined to suggest it's not, and even in so that there were two PDF attachments to the email that Mr. Morrow had sent yesterday. The second was a 5-page, and it does have a funding schedule, and you will note on page 1 of that, even though, as you are noting, Councillor Frenier, there was a component of this funding for dispatch, but it is not germane to any of the information that is before us. So I'm assuming that this is exclusive to paramedic services, though I'm certainly open to your input, Chief Nolan.
Yeah, I think it just illustrates one of the many questions we have about the intention of the document. And while we did have some paramedic involvement in the vaccine clinics in Pembroke and throughout, we can only, my belief is that we can only attribute the cost associated with our involvement. So that this is part of the ongoing questions that we're working through, hence not being able to give you a fulsome answer. We tend to try and do our homework first and then bring it back in a way that's coherent. I don't think this funding announcement's actually that coherent. While it's welcome as a dollar value, it seems a little rushed and doesn't seem to have a fine enough point for me to be able to come to committee and say, here's what we did with the money. So stay tuned for that. Next month, I hope we'll have the answers and be able to bring it back in a way that leverages everything that is possible.
yeah, because further to my comment, I did bring up with our own treasurer when we were going through budgets and last year's expenses, that type of thing, that some of our expenses related to the vaccination clinics could have or may have been funneled through the county COVID relief because of the fact that we share all our health services, paramedic services, social, all those expenses generally come under the umbrella of the county and we pay a share. So that's why I'm going in that direction in this conversation, is wondering if there was an avenue for the city to recover some of those expenses that were not covered through the COVID relief program that we had access to. Okay. So I'm sure you'll let me know in the future if something should change. Thank you.
Thank you, Councillor Frenier. Chief Nolan, as you and I have discussed, I think the challenge here is to determine whether this is a chicken or whether it's a cow. Anything further on the new business? Do we receive this as information, Mr. Morrow, or is it simply an information item within new business?
For the purposes of the minutes, if you would like to receive it as information, that would be fine, sir.
Okay, thank you. I would invite Councillor Doncaster has moved to receive as information, seconded by Councillor Murphy. Once more, final opportunity for question or comment. Seeing none, all in favor. That is carried. Thank you. There was no closed meeting. Well, I should back up a little bit. Any further new business, Mr. Morrow? There is none.
That's sir.
Thank you. There was no closed meeting at time of mailing. I assume that we are consistent. Thank you. Date of the next meeting will be Wednesday, April 13th, 2022. I would now seek a motion to adjourn, please. Councillor Emo in the disco. I love the flashing light that you have going on there. Seconded by Councillor Love. All in favor? That is carried. We are adjourned.